Dr. Henry, at the start of your comments today, you said looking back helps to put things into perspective. So 2 years into the pandemic, what is there that you and Minister Dix wish that British Columbia had done differently? What are your regrets? And in English and French, please.
Yeah, I'm not sure I'm at the point where regrets are what we need. It's more about looking at how we adapted as we did and recognizing that change is difficult and it's hard. And, it's easy to look back and say, oh, well, that was obvious, it was coming. But when you're looking forward and you don't know how high the wave is going or when it's going to start or when it's going to decrease, it is a very different perspective. And I was trying to remind us all that there are many things that were unknowns that we now take for granted in some ways, and that we were very focused on specific tools that served us well through much. But now, as we're changing, or as we're seeing a new virus that has changed, a new strain of the virus that has changed, those old tools that served us well are not working anymore, and we need to find new tools and new strategies. And that there is hope that this movement through this phase of it is going to push us to that point where we no longer need to take those extraordinary public health measures and societal measures to be able to live with this virus and manage it effectively in the future. I think if I regret anything, sorry, it's really that my challenges in being able to communicate when we've had major changes and to communicate why we needed to change things in a way that was accessible to everybody. And that continues to be the challenge. And one of the things of doing this today was to try and put some perspective around the language that we've learned and how we've moved ahead with it, and reassuring people that we have learned a lot. And I guess if I could do anything over, it would be to be clearer in some of those communications, particularly at those most stressful times when things are changing.
I think what I'd say, Belle, is we're right and still in the middle of this, in this moment of the COVID-19 pandemic, and still working hard to both support people. We have about 900, I think it was 977 people in hospital yesterday. It'll be, I think, about the same today or just slightly higher. And so this is a moment where we're right in the middle of supporting our healthcare systems and supporting one another. I think what I would say is that there's always an assessment after the fact. But I think what I find so impressive about Dr. Henry and her approach and her whole team's approach is not to be stuck, but to continue to learn every day and adapt every day. And because when the pandemic came and COVID-19 came on the scene, there was enormous things we didn't know, and decisions were based on less knowledge, and now they're based on more knowledge. But this is a team of public health leaders who has never stuck, who always looks at the evidence, looks at the facts, never worries about whether changing will reflect on the past decisions, but change when it's necessary to protect people. I'm very, very really proud of our public health teams, of our whole teams in healthcare, for their willingness to do that. And I think that's been reflected in the general public, which has been overwhelmingly responsive. A lot of our focus is people, because the vast majority of people have been doing exactly what they've been asked to do. And the vast majority of people, of course, have been vaccinated. There's a tendency to focus a lot on those who aren't, or those who are not following. And I'd say to everyone, and this is true for all of us, is that it's not too late to join. It's not too late. Today is the best day, if you haven't been vaccinated, to get vaccinated. And the assessments and the reflections, well, we're right in the middle of this right now, and the Omicron wave of the COVID-19 pandemic. BC has had, relative to other jurisdictions, some success, but there's also been real losses. And rather than focus on my regrets, I think of all the families who've lost people from COVID-19, all the people affected by COVID-19's impact on the overdose public health emergencies, the healthcare workers who work so hard, the grocery workers and other essential service workers. I look at them with a sense of pride and of support, of course, but also an understanding of what so many people have lost in the last 2 years, and that sense of shared grief also drives us forward at this point.